Erectile dysfunction. It's more common than you think. You know that more than half of men over 40 are going to experience some kind of erectile problem, making it a common issue for men of all age. 26% of men under the age of 40 experience it. 40% of men between 40 and 70 experience it.
And here's the big number.
70% of men over 70 have some degree of erectile dysfunction.
And this can be devastating and a devastating effect of what used to be a normal, intimate relationship. We are so pleased today to have our friend Nancy Lucas with us again to talk about erectile dysfunction. Nancy has a therapy practice right here in Essex, Connecticut, and was a guest on one of our most popular videos, Sex as You Age.
Nancy provides counseling on relationships, both marital and premarital, and she also does some sex therapy to bring couples back together for a better intimate relationship. And we're getting free counseling today.
I know. I'm
This
excited.
Is great. So today we're going to dig deep into the topic of erectile dysfunction, or ED for short. It's so good to have you back.
It's so good to be back. I enjoyed our session last time, and I was just really excited to see such an engaged community that you guys have, and all the questions that they asked after the video. So it's a privilege to be back. Thanks for having me.
So we want to unpack erectile dysfunction. Our research, Jody and I did, it can come from stress, anxiety, depression, cardiovascular disease, diabetes, and obesity.
Yep.
But it also can indicate something else going on in your body too. But there's, issues like smoking, lack of exercise, alcohol abuse, all contribute to men getting this, we call it a disease?
A disorder.
A disorder.
Yeah.
So why don't you help us unpack this? What is erectile dysfunction, and how do you, well, I'm sure you don't catch it, but you get
it. Well, yes, it's not something that can be caught, but obviously, so erectile dysfunction is defined as a male sexual issue, anything that prevents you from getting an erection and being able to maintain an erection. And, the way I like to think of it is that our bodies are machines and penises are machines. And in order to get an erection, you need to have really good blood flow so you can have hard and maintained long-lasting erections. So if you think about it, to simplify it a little more for everyone, it's really anything that prevents the blood flow from engorging the penis. So there are lots of things that can do that. There's lots of things constrict our veins. So again, you said alcohol use, stress, certain medications, diabetes, cardiovascular systems. It's all those things can cause the blood flow to reduce to the penis, and then you experience erectile dysfunction. It's very common.
So we're 2 minutes into this video and you've said penis 12 times.
I know. Everyone take a sip of something. Every time I say penis, you could, yeah.
We should take a shot.
Exactly.
No,
maybe not a shot, but a wine or beer.
Yeah, a couple of things that you said made me think that erectile dysfunction can actually be perhaps a barometer for other health issues that a man may be experiencing. Is that the case?
Yes, absolutely. That's what a lot of physicians say, is that the penis is a great bellwether of overall health. So if you do start to have erectile dysfunction symptoms, and what they really categorize as erectile dysfunction, like that you have it, it's if you have problems maintaining or getting an erection more than half the time. That is the time when you should go and see your doctor. That's really indicating that it's a problem.
So there's no real test a man can do. It's really just that, whether or not you can get and maintain an erection more than 50% of the times you try.
Right. So look, every man experiences some form of erectile dysfunction through their lifetime. It's normal. when you want to maybe go and consult with your doctor, and that's the first thing that you should do, is if you're not being able, if you're having erectile issues more than half the time. That's sort of the, what you do. But um, men can have erectile dysfunction all the time, and there's such a stigma attached to it, and it could be so emotional, and it could be really something that divides couples. So that's why I'm really glad that we're doing this topic today, because I think it's something that really needs to be destigmatized. It's common.
Let me ask a question. It was we talked about some of the lifestyle choices that we make that could contribute to erectile dysfunction. So the 30% of men over 70 that don't experience erectile dysfunction, is that because they're living a cleaner life, or is it also you're going to get it because it's hereditary, or it just happens to certain men and it doesn't happen to other men?
It's a very complicated question that you're asking me. It's a good question. I wish I could give you like a solid answer. Like, look, if you do this, you won't get it, or you could join that 30% only if you do this. But it's usually more complicated than that. There's hereditary involved, um, lifestyle, of course, like alcohol and marijuana, recreationally using that can really make the veins and the blood flow smaller. So anything that really, if you think about it, like a machine, and I like that because it removes the stigma. If you're doing something that's going to limit your blood flow, and we know that alcohol limits the blood flow, anything that dilates our vascular system, that's going to increase your chances of getting erectile dysfunction. But of course, age plays a big role too. As we all know, our veins constrict as we get older. So there's a lot of complicating factors to that. So I wish we could give
And
a
at the
more
end of this,
direct answer to that.
yeah, thank you. At the end of this video, we're gonna talk about some of the solutions or treatments, and then at the end, you're going to give us 5 tips on what couples can do to have a conversation about this.
Yep.
So again, I guess it's not a sudden change; it happens slowly over time. So men will get 10% of the time they have erection problems, and then 20%, and then maybe 30%. And is there, and you said once you get to 50%, then you should really talk to your doctor about it, right?
Right. I want to normalize it because it does happen to everyone and every man. And when it happens, a lot of people freak out and say, oh my God, is this going to happen again? Um, but it is something that happens, and we don't always know the reason for it. But it really becomes an issue if it's over half the time you can't reach an erection or maintain. That's when it's really time to go see your doctor.
Well, it's never happened to me.
so I'm gonna not touch that with a 10-foot pole. So let's dive a little bit deeper into the psychological effect that it has on men, and I know that's the primary focus, but I'd also like to, within that same question, dive into the psychological effect it has on his partner.
Right. So, look, men often tie the ability to have an erection with their identity. We just do. It sounds cliche, but look, cliches are cliche for a reason. And a lot of men really see that having an erection is a measure of their masculinity. And if I could disabuse people of that idea, because really it's a physical thing. I want you to think about, that the penis is kind of a machine and it's about blood flow. And look, if you have a heart condition or any other condition, do you really think that that takes away your masculinity? No, I mean, some people do, but really it's a physical condition. The machine isn't working. There's usually reasons why the blood isn't dilating. It's not anything you did. It's not personal. So, so that sort of guilt and that identity crisis can happen when men experience ED. And it makes me sad. I wish, they I'm hoping through this video we're able to educate people that it's not personal, it's not nothing you did, it's not a sign of weakness, it's not a sign that you're not a man. It's just that this mechanical part of your body isn't working for probably a good reason.
It brings me back to grammar school and high school and sports and
Yeah,
the first time, and I was very immature for my age, but I remember the first time that I had to go into the team shower after playing soccer
yeah,
and looking around at these ninth, 10th, 11th, and 12th graders.
yeah,
And I'm like, oh my God.
yes,
And
yes.
I was, I felt so inadequate. And I still feel inadequate at times.
Well, look, we all feel inadequate at times. It's how are you going to measure your inadequacy? By the fact that, something's not working in your body? It's not a good
Well, I
way to
guess for
transition.
men, yeah, I'm a man, so it's outside my body. It's there you can see it. I
Hmm.
can't hide it.
Right.
And for my whole life, that has been part of my identity. I mean, it is what it is. But I understand what you're saying is how to detach yourself from that. For men, detach yourself from that as a measure of who you are. And I guess that's part of the therapy that you do with folks when they have this problem.
Yes, 100%. I mean, look, it's again, there's other issues that we have physically that we don't feel afraid to discuss with our partners or our doctors. There's a stigma around sex that I think causes people unfair suffering. So,
Yeah. Well, it kind of boils down to, a bit of embarrassment or shame
yeah.
or, like you said, that stigma or lack of awareness, even partner to partner. And I know I keep going back to the
No, no,
partner
I
in
wanted to
this, but
address them. I wanted to
yeah,
address
because I do think that, as a partner, and intimacy and closeness is such a big tie to your relationship. It's almost embarrassing and shameful and lack of awareness, all those same things for the partner to bring it up to begin the conversation. How do you help people begin those conversations together?
Well, first of all, what I like to do is to remove the fact that it's anyone's fault. Because Jody, you're so right. The partner can think, oh my gosh, they don't find me attractive any longer. Is this my fault? Is this something I'm doing? And then the partner experiencing ED can say, oh my gosh, I'm not going to be able to satisfy her. She's going to be thinking that I'm less of a man. And it's so these usually people in a couple are swirling within these sort of guilt, shame, anxiety circles, and they're not sharing it with each other. And right there,
Right.
that's disconnection. So,
So, yeah, I want to go not necessarily deeper, but I'm a man and I know what it feels like
mhm,
to have this identity and have it perhaps not work like I want it to.
sure.
But the woman's side, a friend of mine the other day was telling me that he has low testosterone. He just had that analysis.
Hmm.
And now, because of that, he can't perform like he used to. But the good news is his wife doesn't have to worry that it's her, it's him. I'm like, oh, okay.
Right.
But it's that still doesn't make it okay. I'm sure the female partner feels like, I mean, how do you get the female to feel okay that it's not her?
Or
I
the
mean,
partner,
or
just
the
the
partner.
partner in
Yeah, it
general.
could be a man. I mean, who
Right.
knows? But
So, if we could look at this like every other issue that you guys have dealt so well with in your relationship, and I know you guys have, raising children, having problems at work, all these other life issues that you kind of come together and tackle together as a couple, ED can be one of those things that can even bring you closer. The thing that's so disconnecting about it is that both partners often feel at fault somehow and that they're making
mm,
their other person unhappy somehow. So the solution to that is to really be open. I mean, again, what we shrinks love to say, communicate, communicate, communicate. But that's really, having the bravery to open the subject very gently, pick the right time, and start to talk about it in a supportive and open and even curious way. What can we do about this? You know, instead of what can I do about this or what can you do about this? How do we share this? How can we look at this as just another obstacle in our connection? And before you know it, you're
So,
connecting over it. The problem is not internalized in either of you. It's something as a couple that you could start to tackle together. And
so for a couple, sorry.
that's okay.
So for a couple that are struggling with this, and it's up to, I mean, the first time I guess is kind of like, oh my gosh, what happened? Then it's 20%, 30%. When it gets up to be a regular basis, it's it's time to really have that chat.
Mhm.
And why is it, or I don't even know if there's an answer for this. Why is it so difficult for men to talk about erectile dysfunction with their doctors and their partners? Is that a built-in problem that we have as men?
Well, again, what you said about having it be so tied to your masculinity. And let's face it, I mean, with the last video we did, we tried to sort of destigmatize sex and sex as you age and things that people don't talk about. And again, and if folks want to reference that, we talked a little bit about that. But look, sex is this beautiful way of connecting with your person. And so erectile dysfunction, I think if you can approach your relationship in that way, that look, this is an us problem. This is something mechanical that's not working. It's not shameful. It doesn't mean you're not a man. It doesn't mean you're not going to satisfy me sexually. And again, like we talked about in our last video, there are a ton of ways to have sex, tons of ways to have sex that don't include intercourse, that can be
Right.
wonderful and satisfying for everyone. So
Right.
it's just, I think the old fashioned Victorian stigma, especially that we have here in America, but it also feels so personal for men. That's why I think it's so hard. It's an exposure of weakness, I guess. That's how they think about it.
I also think it opens the conversation. If you think about it kind of on the flip side, not the erectile dysfunction, if you flip it to how do we want to be intimate as a couple? What does that look like and feel like for both of us?
Yes.
And how does that satisfy our needs? It's not as it was perhaps when you were 25 years old and it was all about intercourse, right? It was just about the
Right.
sex.
Right.
Intimacy, and I know we did talk about this in the Sex as You Age, intimacy changes so much for both parties
Yes.
that it would seem with good communication, this topic of erectile dysfunction could lead to greater intimate moments, longer intimate moments almost, because there's a world of other intimate strategies that are out there.
Yes. Well, that kind of, speaking of sex and sexual satisfaction, one of the things that they talk about if you do experience ED is for men to masturbate and to really determine, and together with their partner, what really feels good to them. Because look, a lot of times, who gave us messages about how to have sex, right? Like, I don't know, some people read Playboy and today, I'm sorry that porn is just so accessible. A lot of people are learning about having sex through porn, which is, by the way, not designed to be an instructional manual. It is designed to entertain. So there's not, just like you wouldn't expect, you would go to a romantic movie and you wouldn't expect to, like, this is what my life is going to be like, which I do think a lot of people expect that. And I have a job saying, well, here's what the real thing is. Yeah. Here's what real love looks like. It's not always great to watch, it's not always entertaining. This is what real safe, connected relationships look like. But so getting back to porn and masturbation, if you can determine what actually feels good, you can help your partner try together to overcome erectile dysfunction with a little more focus on exactly what feels good, which gets us back to communication.
My mother told me that if I masturbated, I'd end up going blind.
Right.
And
Yes.
look, I'm wearing glasses. So
That is
His
that
vision is
old
not very
wives'
good.
tale. You don't want to waste the sperm, but actually not true. It's really good for you. It's a stress release. It's good for you. So, but you don't want it to take the place of the intimacy with your partner.
Right.
Same with porn.
no, and in the book that I just wrote, The Evolving Man: Life
Mm.
Virtues Men
Oh
Don't
yes,
Talk About,
yep.
I talk about the time that my dad gave me the sex ed talk. And it was awful. I mean, he did it with his hands like hand puppets, and it
Like
was
real
it was
puppets.
not the kind of hand puppets. It was not the kind of sex talk that was productive for me as a man. And as I was writing this book and this memory came back, I remember calling my three sons saying, "Hey, did we have a chat? And what did I say?" And they said, "Oh no, it was fine. Practice safe sex, wear a condom, things like that." So I was like, I didn't get through that. But I think generationally, it's changing for sure. I grew up at a time when there was Playboy and Penthouse. That's it. Now, like you said, porn is so accessible, and if you watch it, you think, well, that's how it should be with us, right?
Mm.
Running around in ropes and chains and all that.
Mm.
How come we don't get involved in that?
That could
So
be
yeah,
another
I
video.
think that yeah.
um,
So yeah, there definitely is some mental issues that men have to come to grips with. The men that are watching this video, and the wiser husbands too. I think what I'm hearing is demystify it, make it a you problem, the couple, and talk about it. I mean, just because it happened doesn't mean you're a bad person, or you don't love your wife, or you don't find her attractive. It's like it's mechanical problem that can be fixed.
that's right. And I love that. It's a mechanical problem. And again, if you discovered that you had a heart condition, would your wife take that personally? Your partner, would you feel less so? I mean, I could see, look, my body is changing or not working as well, and that could do a little something to your self-esteem, but nothing to the level of the shame that people feel when they can't achieve an erection. And it's really a mechanical issue. It is not personal. And if we could remove the shame from that for your, wonderful followers through this video, then I feel like I will have accomplished my mission here.
I do think I agree with you. I think it's removing the stigma, removing the shame, removing the blame, right? So remove those three things. And then again, just with your loving, caring partner, have conversations about what great intimacy feels like to each of you. Because I know as a woman, because I know Mark said 3 or 4 times, I'm a man in this conversation,
Mm.
but I know as a woman, things that used to feel very good and intimate for me, really connecting with my partner when I was 25,
Mm-hmm.
aren't really the same at 60.
Mm-hmm.
So, there's a difference, and acknowledging that we both have changed separately, but that doesn't mean we can't be intimate together, I think is just a positive way to start the conversation, a safe way to start the conversation, and honestly, a truthful way to start the conversation. And I think that's what's missing in a lot of the couples that we have conversations with. They're not acknowledging the changes that have taken place over the past 40 years in their bodies, in their sexual appetite, and in their ability to really feel intimate with each other. And what they do, Nancy, unfortunately, a lot of the couples that we talk to, they just don't talk about it. They just don't have sex. They don't. And then she can tell her girlfriends, well, it's not working.
Mm.
And he can tell his men friends, my wife just doesn't want to be intimate. And both of those are false statements.
Right, right. That's why, again, communication and and sometimes you might need a third person like me to help facilitate that. But of course, my job is always to make myself obsolete. So people don't need to go to therapy. So if they can really find a quiet place, a time where they're both focused, say, I'd like to have a really intentional conversation with you, and approach the subject with openness and curiosity. And then if you can say, let's deal with this together. Let's get educated. Let's read an article together about it. There's plenty of information out there. And, we live in a time where at the click of a button, we have all this research at our fingertips. It's really fantastic. You'll see the message that the three of us are putting out today is in all the literature. That it really is, it's something that's treatable. And the folks who do the best with treating it have an involved partner, a supportive partner, an interested partner, and it's something that they do together.
So if a man suspects, or a couple suspects, that a man is having ED, and it's going to be obvious because it's either not going to get erect or it's not going to last long,
Mm-hmm.
who's the first doctor that they call? Their GP or their specialist for this? Do you need a urologist?
I mean, all of those are good choices, but depending upon who you have a relationship with, I mean, some people have a better relationship with their urologist than their general practitioner. But I would say, the GP is a great place to start. And you go into that office and you talk about it like any other health problem, because it is any other health problem. And that's how the physicians feel about it. Happy to talk about it.
Is it advisable that the couple go in together, or should the man go in alone the first time?
Well, look, it's comfort on the man's part, but I would love to encourage women to go with their men. I think that would be a great way to just start that connection that we're going to deal with this problem together. That it's not.
But before we get into treatment options, are there lifestyle changes that men can make right away to help alleviate the problem?
Okay, so I'm going to sound like the broken record that all other professionals in the medical field sound like. Lifestyle, of course, is diet. That's where you start. Junk food, all of these things. You have to think about anything that's going to build up plaque in your circulation system, like fatty foods and things like that. That can lead to, again, restricting those veins. They actually did a study that lycopene, which is found in watermelon, tomatoes, papaya, red peppers, that lycopene really helps enlarge the veins in our circulatory system. And that can be something that, people who are experiencing ED kind of try to eat those vegetables, put them in their diet more. So recreational drug use, alcohol is a vasodilator. It's as is recreational marijuana, not exercising, obesity, all of these things serve to constrict the veins to the penis and can cause erectile dysfunction. So it's like the same old thing that you guys hear: diet, exercise, eating right foods, and really getting out there and moving so your circulatory system is getting supported. Those are the things that lifestyle can make a big difference.
It's so interesting because what I'm hearing is that your body is like a machine, and that part of your body that's outside your body and you can see it, whether it's working or not, versus your heart, you can't see it. You can't see your lungs. You can't see your veins.
Right.
But if your lack of the ability to get an erection is there, then you've probably got small veins, or you're drinking too much, or eating crappy food, and all of that. So interesting as that as a barometer, which is what we said earlier.
Right.
Are there before we get into treatments, how does sex therapy play in managing or overcoming that?
So the biggest part that sex therapy can play is to help the two people, like I've been saying, talk to each other and make this it's a relationship issue. It's not just the guy's fault or the woman's not attractive enough, as we said, but it becomes this thing that you work on together, and being able to help people talk about it, overcome that uncomfortableness with addressing it with each other in a supportive and open way. So that's the first part. The other part that really sex therapists who are certified sex therapists who really can make this the focus of treatment, help to have people touch each other in a different way, address and approach sex in a more tender physical way, try to take the pressure off of it. That's really the treatment for ED in sex therapy, and it can be very effective.
So, what are some other common treatment options for ED? I know we've all heard of obviously
Mhm.
Viagra,
Yes.
Cialis. Are they treatment options for ED or just band aids?
No, those are treatment options. Again, they make your veins wider, and that's really what they do. They're So I think if you really have a serious erectile problem, you may have to stay on Viagra or Cialis, like anything else, like a blood pressure medication or something else. Um, there's other interventions that involve injecting a vasodilator directly into the penis. That could be very, very effective. They also have vacuum pumps that, through suction, increase the blood flow. So, again, if you think about it in this mechanical way, anything that increases the blood flow can be very, very effective in treating ED, not just having to take medication. Sometimes the medications, the Cialis and Viagras, can cause headaches, dizziness. They could have other side effects. Although I don't hear that those are really reported, but they can happen.
So the idea behind Viagra or Cialis is that men take that every day for the rest of their life?
Hmm. Or a lot of people take them
Really?
just like PRN, which means, when you're ready, an hour before you're going to have sex. So you don't have to stay
Hmm.
on them. But a lot of men, especially older men, men over their 70s, take it when they're ready to have sex. I think it takes about an hour or two, within an hour to work. And then they can have satisfying intercourse.
Hmm.
So, it sounds to me that there are some medical, even surgical and non surgical
Yep.
remedies. But the mental health care side of it seems to be just as important and just as
Yep.
beneficial. Would you agree with that?
Yes, absolutely. I think I have it written down here. I think that there's like 1/3 of people improve with ED with just therapy alone. Just having it come
Mm.
out, having it with your partner, having it be an open discussion, taking the pressure off, that can actually help 1/3 of cases,
Hmm.
which is really interesting.
That is very interesting. And it's pretty big size of the population, if you'd think. 33% can, do it by just having the communication, the supportive partner, the conversation around intimacy. I think that's a great starting place for
Yeah.
sure.
Yeah.
Yes.
You talked about oral medications, Viagra, Cialis. On Instagram now, this thing called Hims keeps popping up, and
Right.
other ones called Roman. And you go into a gas station now, and there's pills hanging up on the wall that all they help you with this problem. I mean, I guess you have to really be careful about this. This is something you really should get from your doctor, not from a gas station.
You're 100% right, Mark. I mean, look, they're all, as long as humans have been around, there's been snake oil salesmen. And again, the thing that it appeals to is people who don't are afraid and don't want to actually go to their doctor and talk about it. Those things have not been shown to work. I mean, there's the placebo effect is very effective, but really they're not regulated. You don't know what's in those things. I mean, they talk about rhino horns being ground up and all this stuff in there. You really don't know what's in it. I would avoid
Hmm.
any of those gas station things or anything that you see online that's touted without medical research and behind it.
I'd like to hear more about some of the other treatment options for the folks who are watching this, because it's not something that I mean, I don't even know where we go to get information like this, but we're giving it now, so I want to stick with it. But you mentioned a pump. What is
Yep.
what is that?
So it's a bladder of air that you insert into the penis, and you pump it up, and it really helps maintain an erection. So if the blood vessels are so damaged that all of the other things really don't work, that you can have an implantation and you pump it up, and it's very effective. And I know it could make some people sound a little squeamish about it, but people are really, really satisfied with that intervention. So don't be afraid to be open to anything that would help.
So it's a surgical implant, and there's a pump outside the body that you like
Yeah.
that.
And look, this is
Huh.
again not my area of expertise. I don't know
Right,
exactly. I
right.
think there's a bunch of different ones. I don't know exactly. I think if you were to talk to your physician, they would tell you exactly which one is right for you.
Okay. You also mentioned injections, I
Yep.
think.
So injections into the penis that opens up the veins and causes the blood to flow. And if they use vasodilators that they use for other medical issues, but it's an injection in the penis, and it just really opens up the blood vessels, and the blood's able to flow, and you get a good
So,
strong
so
erection.
that's something that the man has to do before sex, inject himself or
Mhm.
pump up the pump, and then he's ready to go.
Yep.
There you go.
Yeah.
Ready to go.
Yeah.
All right.
Exactly. It's like,
What?
look, it's like putting on a condom. You know what I mean? It's just
Yeah. I can't imagine the surgery involved in that, but I'll skip over it.
When we were much, much younger, much, I can't stress the much enough, younger, Mark was going to go get a vasectomy until he
So the day
realized
before.
the day before he said, I can't do this. And I was like, oh boy, here we go.
Yeah.
I can't have anybody touch that.
Not with a knife.
Not with a knife. Yeah.
What about, let's talk about testosterone. Is that a lack of testosterone or low testosterone? I don't know if I'm saying it right.
Testosterone.
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 Is that a problem? And is there a solution around that one specific issue?
Yes, I mean it can anything. So that's the thing about ED, is that it can have many different causes, and once you get with your physician and talk about it, you could try a variety of different things. Testosterone, a lack of testosterone can affect energy, sexual desire, and yes, and because of that, the ability to get erections. But it's readily available to get supplements from your doctor, and then keep track on what the effect is. So
Okay.
yeah, that's another option.
Can you
Many
talk?
options.
Can you talk to us a little bit about some of the therapy that you've been doing with couples and some of the successes that you've had, or not
So
success?
I will tell you that there are specialists out there, and they are certified sex therapists. I've had training in sex therapists, but it's not all I do. So there are certified sex therapists that work just with ED and other sexual issues. And what that involves, and what I've done with my couples is that I've made it part of sort of the couple's connection. But what a certified sex therapist can do is really work on the communication together, and then work on ways to have sexual connection that involves more tenderness. And again, like I said in the last video, is not so goal oriented. It's the goal orientation of how many people have sex that can put so much pressure and just make people suffer around this issue unnecessarily. But a certified sex therapist will also help you be more tender sexually, really learn how to get each other aroused. So they'll really teach you those sorts of things that can also help overcome ED.
And that has to be hard for a
Mhm.
couple to sit down in front of you
Yep,
and openly discuss this, I imagine,
of
right?
course. Yes, it's very hard, but most of us in this field that do this are trained to be warm and welcoming, and again, destigmatizing, because the stigma is just causing so much pain that is unnecessary.
The majority of our subscribers are about to retire, in retirement, already well deep into retirement. And, the stats would show maybe they're 55 and older. So A lot of them couples, a lot of them single, but it does affect both. Does affect both the single
Yes.
men and the single women, as well as the couples. I think it's important because ultimately, if you find someone and you are single, the intimacy and the connection is going to start maybe different than it did when you met your first love or your first husband or your first connected partner. And I think one of the things that I would like to make sure comes across is intimacy takes time now as you age. It's not the same as your dad would have said, wham bam thank you ma'am, right?
In
it's
the back seat of the Ford.
it could be that, and wow, wouldn't that be exciting, but it's not always that. So tell me a little bit about how you coach people, solo partners, people connected, gay couples, whatever it is, to take time with each other in this intimacy journey.
Right. Well, you said something, and I actually think one of your really open and interested listeners commented on our last video. They talked about, we talk about erectile dysfunction and sex education with men, but women, especially postmenopausal women, start to have more of a thinning of vaginal tissue. There is not a lot of lubrication. And the fortunate thing about that now is that there are places that you can go and have a consultation around hormone replacement. They have hormonal rings that you put into the vagina, like the sponge birth control method, that really helps kind of strengthen the walls and provide more lubrication. So there's a lot of things that women can do too. And, if men and women are looking at this together because they want to connect as they age, they're in this changing relationship or they're discovering each other for the first time at this age, again, this could be part of the connection. Like, what should we do? What can we do? I really see it as it's part of the adventure, and it's part of another opportunity to support each other as you age in a couple.
Have you had couples come in that blatantly just say we haven't had sex in 10 years and it's now kind of causing a problem and we don't know what to do about it? I mean, I guess some couples just say, well, I can't get an erection anymore, so we're just not going to have sex, and they don't talk about it, and it's just over, and they maybe even go as far as separate bedrooms and all of that. What are some things these couples can do that are watching this video right now, realizing, well, maybe there is a path forward for us to be more intimate?
That's a great question. Look, every marriage is different. Every marital connection is different. There are those couples who are very happy living that way, who just, have kind of put sex on the back burner and concentrate on just, the more platonic and warm part of their relationship. And there's no judgment there. That's fine. But if this is something that they feel like they're distancing themselves from and that they miss, they can come in and talk about it and slowly, slowly open up. Like we said before, and I'm sure you've had other folks that are your followers talk about this. Like, usually one person is, kind of sitting on it and ruminating about it, but they're not bringing it up. So, you really have to feel safe and find a good time and start to open up your heart and your feelings to your person. It's very scary, but that's the first step to doing that. And then if you both feel like it's an issue and a problem, you can start to work very slowly towards those steps of incorporating it back into your life. And again, it doesn't have to go straight for the intercourse. It can be, let's just get more physical. Let's hug at night. Let's share a movie. And at night, let's just get naked and hold each other. Let's start to experiment with that touch exercise that I talked about in the last video. Like, what really feels good? And that's really, you could get slowly come to a goal where you feel close. You don't need intercourse to orgasm. You don't. There are many ways to orgasm without intercourse. For whatever reason, our culture feels like that's the penultimate sexual experience. but it's not. The closeness is what keeps us bonded and connected.
This is awesome. What a really great recording. I've learned a lot, and I know our followers have. What let's think about, Nancy, if you will. What are 5 steps that couples who are watching this, sitting side by side or separate, maybe they'll watch it again as a couple. I guess they should watch this together as a couple would be the first thing. But what are 5 steps they can move forward on to work on this problem that exists in their relationship?
So I would say the first thing to do is take the risk to talk about it with each other in a non-blaming way, a non-shaming way, but really take that risk to bring it up. Like, we have an issue here, and I don't want it to be something that divides us. I want it to be something that brings us together. So that's the first step. Talk about it with each other in an open, curious, non-blaming, supportive way. I would say the second step is, and this is something you could do together, is educate yourself about the issue. Again, no other time in the world have we had the access to so much information at the click of our fingers and the handheld computers that, the world is in our hands. Take some time to read together about the causes of ED and what you can do about it. The third thing is make an appointment with your doctor. Like I said at the beginning of the talk, the penis can be a really good barometer of all sorts of health issues. So you owe it to yourself to go and talk to your doctor and really see what's going on. The fourth step would be to really start to think about, wrap your mind about being intimate in different touching ways that can remove the pressure from the erection, from intercourse. That's like, the goal. There are so many other ways to support your partner, feel connected, feel close, removing the pressure from having an engorged, penis that has to show up for sex to be great. That would be the fifth thing or the fourth thing. And then finally, I would say this is another opportunity for you to overcome a problem in your relationship that can really bring you closer, strengthen your relationship, and really make you guys one of those marriages that people look up to. They can tell if there's a connection there. And if you're working on an issue like this together, it's a relationship issue. It's not just the man's issue. It's not just the woman's issue. It's a relationship issue. And if you could focus on that, then you're going to be a great, strong couple into your golden years and beyond.
This was awesome. I one of the things you said earlier was that there's this blame game where I get together with a bunch of guys. Wow, she doesn't want to have sex anymore, and then you get together with some women, and they might say, I don't know, what would they say, that he doesn't want to?
Yeah, or the equipment isn't working.
Yeah,
or,
right.
something along those
Right.
lines.
But they don't deal with it.
Right.
They just sort of live that way. And what I love about this and what I learned today is there's a lot of ways through this, with change of lifestyle, with some medication perhaps, or the pump and the other stuff that's you talked about. I think it's great. We were hesitant to bring this topic up to our audience, but we hope that all of you guys liked it. It's important. And Nancy, you did a wonderful job. I'm so grateful that you were so open and supportive during this conversation.
Oh, I'm honored that you guys have me. And again, I'm honored to be able to direct to your listeners. You giving me that opportunity to talk to your many listeners it's a privilege. I appreciate you having me.
And we'll put your contact information below. I know on the last video some people reached out, but we'll add that. And if anyone wants to call Nancy for some help, that's great.
That's awesome. Thank you so much, Nancy. We do really appreciate it.
Thank you so much for having me. Always love talking to you too.